If you're female and you've attained puberty, you're menstruating, and you're sexually active, then this video is for you. Also, if you're male and you have a sister or a girlfriend, a fiancé, then this video is also for you. In this video, we're going to be talking about vaginal discharge. What is vaginal discharge? The importance of vaginal discharge, the various types of vaginal discharge based on their colors, the normal and the abnormal vaginal discharge, and the treatment options that are available for the various abnormal vaginal discharge one can have. Let's dive into the meat of today's video. Vaginal discharge is the fluid or the mucus that is secreted by the glands that are present in the vagina and the cervix. One may wonder, does vaginal discharge have any form of importance? Yes, it does. Firstly, it helps to keep the vagina clean, and then secondly, it helps to clear off dead cells and bacteria that are in the vagina. Thirdly, it helps to lubricate the vagina even during sexual intercourse. And then lastly, vaginal discharge helps to maintain vaginal health. Vaginal discharge is very common as it can occur at any age. However, it is more common after puberty. You started developing your pubic hair, your axillary hair, your breasts have started developing. Yes, it is at this period that vaginal discharge is more common. Vaginal discharge has various characteristics which ranges from the color to the consistency to the amount and even to the smell. Now the color ranges from clear to milky and then to white. Sometimes it could be gray, red, yellowish green. As we proceed further, I'm going to be differentiating the normal from the abnormal vaginal discharge using these colors that I have mentioned. And then the next is the amount. Now the amount of vaginal discharge varies from persons to person. The amount of vaginal discharge Miss A is having is going to be totally different from the amount of vaginal discharge Miss B is having. And all these are going to depend on the individual as well as hormonal changes such as ovulation, pregnancy, and even arousal. Yes, vaginal discharge can also be affected by arousal. The next characteristics of vaginal discharge I will be talking about is the odor. There are some odor of the vaginal discharge that is peculiar to a particular infection. As we move further, I'm also going to be enlightening you. Vaginal odor ranges from mild to neutral, to foul smell, to offensive, and even sometimes fishy odor. The next characteristics of vaginal discharge is the consistency, and the consistency of vaginal discharge usually depends on the time you are in around your menstrual cycle. So it could be from thin to watery, to stretchy and thick, to cordy, and sometimes it can even be cheesy. Like, having understood what vaginal discharge is, the importance of vaginal discharge, and how common vaginal discharge is, we're going to be talking about what happens when I see a vaginal discharge that I am not familiar with or is not the normal vaginal discharge that I am used to. So the next part of this video, we're going to be unraveling the normal vaginal discharge from the abnormal vaginal discharge based on the colors, the consistency, the amount, and even the odor, that is even the smell of the vaginal discharge. The first color of vaginal discharge I will be talking about is the yellow-green vaginal discharge. The first organism I'm thinking about is what is known as chlamydia trachomatis. This organism is a bacteria and it is the #1 cause of pelvic inflammatory disease, and it can be contracted via having unprotected sensual intercourse with an infected person, be it anal, vagina, or oral sex. The disease can be contracted as long as the sexual act was unprotected. The infection is common in younger women. However, it can affect all age group of women. It can even affect men. Yes, it can. But for the purpose of today's video, we're going to be talking about various vaginal discharge, and men do not have vagina. So let's move on. For most people, they are asymptomatic when they have this infection. They do not have any symptoms. When symptoms do present, they could have vaginal discharge, that is yellowish green in color with a foul odor, dysuria, which is pain while passing urine, intermenstrual bleeding, what is also known as spotting, that's seeing blood spots on your panties in between period, and then lastly they have post-coital bleeding, that's bleeding after sexual intercourse. The good thing about this infection with chlamydia trachomatis is that although it is difficult to treat, but it is treatable. And the treatment for this is antibiotics. You use antibiotics and then you are all good. And the second condition that is also implicated when I'm seeing a yellowish green vaginal discharge is gonorrhea. Yes, gonorrhea can present with a yellowish green vaginal discharge. Gonorrhea is a bacterial infection that is also contracted via unprotected sexual intercourse, and it is the second most commonest cause of pelvic inflammatory disease after chlamydia trachomatis. It is of importance to note that this sexually transmitted infection is caused by a bacteria known as Neisseria gonorrhea. And this disease can be transmitted via having unprotected sexual intercourse with an already infected person, or by also sharing sex toys without washing them, or changing the condom that is used in covering your sex toy each time you want to make use of it. For some persons, the disease is usually asymptomatic, while for others, when symptoms occur, they present with vaginal discharge that is yellowish green in color, pain while passing urine, intermenstrual bleeding, also known as spotting, and then lower abdominal pain. Now, when you notice you have a vaginal discharge that is yellowish green, you have started having a lower abdominal pain, then it could be a pointer that the infection is already progressing to a pelvic inflammatory disease. At this point, you need to see a doctor. Now, the treatment option for gonorrhea is antibiotics. Because the infection is caused by bacteria, what you need is antibiotics. But if you notice any form of lower abdominal pain, you need to see a specialist to manage you very well. Because some of the complications of gonorrhea are devastating, as it can even affect a newborn baby who undergoes vaginal birth, leading to what is known as ophthalmia neonatorium. The third infection that is also implicated when I'm saying a yellowish green vaginal discharge is trichomoniasis. It's a sexually transmitted infection that is caused by a protozoan parasite known as Trichomonas vaginalis. This infection is usually asymptomatic, but when symptoms present, patients may have vaginal discharge that is yellowish green in color and also frothy. When you hear frothy, it means foaming. This vaginal discharge gives you like a foamy pattern, so you have a frothy yellowish vaginal discharge. Other symptoms they can present with include foul and offensive vaginal odor, and then they have vaginal itching and irritation, also dyspareunia, that's pain during sexual intercourse. They could also have redness and soreness around the vagina and the vulva area. The treatment option available for trichomoniasis is antibiotics. Yes, with antibiotics, it can be treated. The next vaginal color discharge we are going to be talking about is the gray vaginal discharge. This gray color form of vaginal discharge is abnormal. It is not a normal form of vaginal discharge. If you see a gray vaginal discharge, what are you thinking? What is coming to your mind? For me, what comes to mind quickly is bacterial vaginosis. Although BV can present with a yellow vaginal discharge, but typically is the gray vaginal discharge. The unique thing about BV, bacterial vaginosis, is that it is not sexually transmitted. It is not a sexually transmitted infection. However, when you have BV, it can put you at risk of having chlamydia trachomatis. How do one contract bacterial vaginosis? Since we are saying that it is not a sexually transmitted infection, I'm going to tell you. Now, the first common cause of bacterial vaginosis is what is known as douching. Some persons, they use all form of fluid and solutions that are available to wash the vagina area, which is unhealthy for the vagina. You see all this feminine wash and all the old washes that is on TikTok, Instagram, people are selling, and you're actually buying them to wash your vagina. What they do is that they alter the normal vagina microbiota, and as a result, they distort the pH of the vagina and reducing the growth of the good bacteria in your vagina, and then leading to an overgrowth of the bad bacteria. And as such, they distort the vagina habitat, and this can predispose you to BV. It's important to note that the vagina is self-cleansing. Yes, it cleans itself by itself, if I can use that language. What you need is to just wash your genital area and your vulva with clean water while the vagina takes care of itself. Avoid douching. It is not good for the vaginal health. This is the most common cause of bacterial vaginosis. When symptoms occur for BV, they have vaginal discharge that is gray in color. Sometimes it could be yellow in color, and then they have this fishy odor. It is a peculiar characteristic of BV. Once your vaginal discharge smells fishy, especially when you just had sex or when you just finished bathing, the fishy odor becomes so worse. That is characteristic of a bacterial vaginosis. Other symptoms that one could present with include a thin and watery vaginal discharge as well as vaginal itching. Now, the treatment option for BV is antibiotics. The next color of vaginal discharge we're talking about is the white vaginal discharge. I mean, we're going to be saying it's white. I don't think anything is wrong with it. White is like okay, but white vaginal discharge that is cordy or that looks like cheese is not normal. Is also an abnormal vaginal discharge. And when I'm seeing this form of vaginal discharge, what comes to my mind is a thrush, a yeast infection, or what is known as vulvovaginal candidiasis. Thrush is a fungal infection that is caused by an overgrowth in the yeast, which is the Candida albicans, that is normally present in the vagina in little amounts. However, there are some things that can cause overgrowth of these yeasts, leading to thrush infection or leading to a vulvovaginal candidiasis. What can cause the overgrowth of this yeast or this Candida albicans in the vagina? The first thing that can cause an overgrowth is one, overuse of antibiotics. Some persons, they have cough, antibiotics. They have runny nose, antibiotics. They have menstrual cramp, antibiotics. They have a headache, antibiotics. They have leg pain, antibiotics. Now, abuse of antibiotics can cause an overgrowth in the Candida albicans, resulting in a yeast infection. And these antibiotics as well can also reduce the good bacteria in our vagina, leading to an overgrowth of this yeast that can result in one having thrush. Now, the number two thing that can cause a yeast infection or an overgrowth of this yeast infection is low immunity. And if you have any conditions such as diabetes, HIV, or use of steroids, these can weaken your immune system and then puts you at a risk of developing a thrush infection. The next thing that can result to an overgrowth of this yeast is high consumption of sugar. This yeast infection thrives well in an environment where there's enough glucose, enough sugar. Another thing that can also result in overgrowth of this yeast is hormonal changes such as pregnancy, use of oral contraceptive pills, and then menopause. Now, these are some of the things that can result in growth, excessive growth of the yeast, that is the Candida albicans, that is present in the vagina. Symptoms one can present with while having a thrush infection include a white vaginal discharge that is cheesy-like or cordy-like, and then the vaginal discharge is usually odorless. Most of the time, it does not have any odor at all. Intense itching around the vagina and the vulva area. Redness and swelling around the vaginal area, as well as dysuria, pain while passing urine. The treatment option for this thrush is antifungal. Now let's talk about the normal vaginal discharge. When do I say I'm having a normal vaginal discharge? So the first normal vaginal discharge is the clear to milky vaginal discharge. Now if you have a clear milky vaginal discharge, then there's no cause for the alarm, there's no cause to worry. You are actually having the normal vaginal discharge, and usually in consistency it is from thin to watery, and then sometimes it can be thick and stretchy depending on the time you're in your menstrual cycle. The smell of a normal vaginal discharge is usually mild or neutral, and then sometimes it could smell acidic, but then it is fine. The amount of the normal vaginal discharge usually varies from person to person or based on hormonal changes. The hormonal changes that can affect the amount of vaginal discharge include arousal, pregnancy, ovulation, and breastfeeding. The next form of vaginal discharge that is also normal is when you are having a pink or a red vaginal discharge. If you're having a pink vaginal discharge around the time you're about to see your menstrual flow, then it could just be a normal vaginal discharge. It's just telling you that little pinky is around the corner and you're about to see your menstrual flow. Or if you're seeing this vaginal discharge few days, a day or two after your menstrual flow, it is still normal. It's just that the flow of blood is a bit slower, so you get to have like thick vaginal discharge mixed with a tinge of pink that is a bit pinky or reddish in color. Then it is just like your flow is ending, and then it is also a normal vaginal discharge. What are the measures to take to reduce abnormal vaginal discharge? The first thing is to practice safe vaginal hygiene. Like I said earlier, the vagina is self-cleansing, it cleanses itself. All you need to do is just wash your genital and your vulvar area and let the vagina clean itself. Number two measure to avoid abnormal vaginal discharge is to quit douching. Quit using unnecessary solutions, liquid solutions, feminine wash, or stuff like that to wash your vagina. Stop doing that. The next way to avoid abnormal vaginal discharge is to always wipe from front to back. Avoid wiping from back to front, because if you do that repeatedly, you're simply bringing organisms such as bacteria that are not the natural habitat of the vagina, and you're bringing them from behind into the vagina, and before you know, you start having an abnormal vaginal discharge. So it is advised that you wipe from front to back. The last but not the least to prevent abnormal vaginal discharge is to practice safe sex. Practice safe sex. Use condoms. Now these condoms, they are available. There's a female condom, there's also a male condom. It is not only your male counterpart that should put on condoms. You can also wear condom if you're female. There are female condoms available. All these things I've said in this video is not to act as a substitute or prevent you from seeking professional medical care. It's just to create an awareness about the various types of vaginal discharge, the normal ones and the abnormal ones. Now I'm going to be listing a few things here. If you have any of these, you should see your doctor. Firstly, if you are having intermenstrual bleeding or spotting, you need to see your doctor. If you are having a gray vaginal discharge, yellowish green or yellow vaginal discharge, you should see your doctor. If you are starting to have lower abdominal pain from recurrent or repeated abnormal vaginal discharge, you need to see a doctor. And then if you're having an abnormal vaginal discharge that is associated with fever, increased temperature, you need to see a doctor. Now, as ladies, as women, we have to take care of our health. So if you have any form of abnormal vaginal discharge that is listed in this video, get treated today. Thank you so much for watching my video to the end. I do really appreciate you guys. To my returning subscribers, you guys are the best. I love you so much. Thank you for watching. Thank you for liking. Thank you for commenting. Thank you for sharing. Thank you for subscribing to my YouTube channel. God bless you all. And if you're new here, you have to click on the subscribe button and also hit on the post notification bell so that whenever I post a new video, you'll be the first to get notified. I promise you, you're going to love it here in this community. Thank you so much for watching. God bless you all and see you in my next video. Bye for now.